Your knee pain isn't permanent, and I'm about to prove it to you right now. I'm going to share 5 strategies with you today that most doctors never tell their patients. Why? Because we're trained to treat symptoms, not root causes. I've spent 15 years in orthopedic medicine, watching thousands of patients eliminate their knee pain without ever stepping into an operating room. You're about to learn techniques that address the actual mechanical and biological reasons your knees hurt, not temporary fixes, not painkillers that mask the problem. Real solutions. Let me ask you something. When you wake up and swing your legs out of bed, does that first step send a sharp reminder through your knee? When you're walking upstairs, do you grip the railing tighter than you used to? Maybe you've started avoiding activities you love because you're afraid of that pain. What if that pain wasn't inevitable? What if your knee could feel strong again? What if you could walk, run, even dance without that constant discomfort? I'm going to show you exactly how. But first, you need to understand something critical. Most people treat knee pain backwards. They rest when they should move. They strengthen when they should stabilize. They focus on the knee when the problem is actually coming from somewhere else entirely. The medical system isn't set up to fix this. You get 15 minutes with a doctor who prescribes anti-inflammatories and sends you to physical therapy. The therapist gives you generic exercises. Nothing changes. The pain persists. Eventually, someone mentions surgery, but surgery should be your last resort, not your first option. Think about everything you'd miss if your knee pain continued for the next 5, 10, 20 years. Every hike you'd skip, every grandchild you couldn't chase, every flight of stairs that becomes a challenge. Let's fix this right now. Strategy Sector 1. Eliminate the hidden inflammation trigger. Here's what I've learned after reviewing thousands of knee X-rays and MRIs. Visible damage doesn't always correlate with pain levels. I've seen patients with severe arthritis who feel fine, and patients with pristine imaging who can barely walk. Why? Systemic inflammation. Your knee isn't hurting just because of what's happening inside the joint. It's hurting because your entire body is in an inflammatory state. And there's one food category driving this more than anything: seed oils. Seed oils, canola, soybean, corn, sunflower. They're in everything: your salad dressing, your bread, your granola bars. These oils contain omega-6 fatty acids in ratios our bodies were never designed to handle. When consumed in excess, they trigger inflammatory pathways throughout your body. Your knee joint, already under mechanical stress, becomes ground zero. Here's what happens. Your body produces inflammatory mediators called prostaglandins. These chemicals make your nerve endings hypersensitive. Suddenly, normal movements that shouldn't hurt begin to hurt. Your pain threshold drops. Your knee swells. The cycle continues. I had a patient, Margaret, 58, marathon runner, who suddenly couldn't run a mile without her knee swelling like a balloon. We tried everything: physical therapy, cortisone injections, custom orthotics. Nothing worked. Then I asked her to keep a food diary. She was consuming seed oils in over 15 products daily. We eliminated them completely. Switched to olive oil, avocado oil, butter. Within 3 weeks, her swelling decreased 70%. Within 2 months, she was running again. Your action step: go through your pantry right now, read every label. If you see canola oil, soybean oil, corn oil, vegetable oil or sunflower oil, eliminate it. Replace your cooking oil with extra virgin olive oil or avocado oil. Make your own salad dressings. Avoid processed foods where these oils hide. This single change can reduce your knee pain by 30 to 50% within 1 month. Strategy Sabadidim. Fix your hip mobility. Your knee pain probably isn't a knee problem at all. It's a hip problem. Let me explain the biomechanics. Your knee is a hinge joint designed to flex and extend in one plane of motion. That's it. Your knee doesn't want to rotate, it doesn't want to twist. But your hip is a ball and socket joint designed for rotation and multidirectional movement. When your hip loses mobility, which happens to almost everyone who sits for more than 4 hours a day, your knee has to compensate. Here's the problem. When your hip can't rotate properly, that rotational force transfers to your knee. Your knee isn't built for rotation. So when you walk, turn or climb stairs, your knee is forced into movements it was never designed to handle. The cartilage breaks down, the ligaments strain, the pain begins. I've tested this hundreds of times. I take a patient with chronic knee pain and assess their hip internal rotation. Almost universally, it's restricted. We spend 6 weeks improving hip mobility, no knee exercises at all, and their knee pain disappears. Your action step: I'm giving you one movement that will change everything. It's called the 90-90 hip stretch. Sit on the floor. Bend your right leg in front of you at 90 degrees. Bend your left leg behind you at 90 degrees. Your right knee should point right, your left knee should point left. Now, keeping your spine tall, lean forward over your front leg. Hold for 60 seconds, switch sides, hold for 60 seconds. Do this every single morning and every single evening. You'll feel tight. That's normal. That tightness is exactly why your knee hurts. As your hip mobility improves over the next 4 to 6 weeks, watch what happens to your knee pain. It will decrease proportionally. This isn't magic. This is biomechanics. Strategy number 3, rebuild your VMO. Let me introduce you to the most underappreciated muscle in your entire body, the vastus medialis oblique. We call it the VMO. It's the teardrop-shaped muscle on the inside of your knee, just above your kneecap. This muscle has one job: stabilize your kneecap during movement. In 90% of people with knee pain, it's essentially not working. Here's why this matters. Your kneecap sits in a groove at the end of your femur. When you bend and straighten your leg, your kneecap slides up and down in this groove. But if the muscles around your kneecap aren't balanced, the kneecap starts tracking incorrectly. It pulls to one side, it grinds against the cartilage underneath. This creates pain, inflammation, and progressive damage. Your VMO is supposed to keep your kneecap centered in that groove. But because most people develop quad dominance in the outer muscles, the VMO becomes inhibited. It stops firing properly. Your kneecap starts tracking laterally. Pain follows. I had a 29-year-old cyclist who couldn't ride more than 10 miles without severe anterior knee pain. His VMO had almost zero activation. We spent 8 weeks specifically targeting VMO recruitment. His pain disappeared completely. He's now riding century rides again. Your action step: you need to wake up your VMO. Here's the most effective exercise I know: terminal knee extension. Get a resistance band, loop it around something sturdy at knee height. Step into the band so it's behind your knee. Take a step back so there's tension. Now, with your foot flat on the ground, squeeze your quad and push your knee completely straight against the band resistance. Hold for 3 seconds. Relax. Repeat. 20 repetitions, 3 sets, every single day. Here's the key: you must contract hard at end range. That final degree of extension is where your VMO activates most strongly. If you're just going through the motions, this won't work. Squeeze like you're trying to hyperextend your knee. That's when the VMO fires. Within 2 weeks, you'll feel your VMO engaged during normal activities. Within 4 weeks, your kneecap tracking improves. Within 6 weeks, your anterior knee pain significantly decreases. Strategy number 4. Change your walking pattern. Most people destroy their knees with every single step they take. Not because they're doing anything obviously wrong, but because they've developed a walking pattern that creates massive impact forces through the knee joint. When you walk, your foot should contact the ground gently. Your arch should compress slightly, absorbing shock. Your knee should bend just enough to dissipate the impact force. This is how the human body was designed to move. But modern footwear has destroyed this natural pattern. Cushioned shoes with elevated heels have trained us to heel strike, to land heavily on our heels with our knees straight. This sends a shockwave straight through the knee joint with every step. Think about it. If you take 10,000 steps a day and each step creates an impact force that's 2 to 3 times your body weight, you're exposing your knees to millions of pounds of cumulative stress every single day, year after year after year. Here's what you need to change. Your foot should land with a slight forefoot or midfoot strike. Your knee should be slightly bent at ground contact. This simple adjustment reduces knee impact forces by up to 40%. I worked with a 52-year-old construction worker who'd been told he needed knee replacement surgery. His walking pattern was brutal. Heavy heel strikes, locked knees, no shock absorption. We retrained his gait over 8 weeks. His pain decreased 70%. He cancelled his surgery. Your action step: this week, film yourself walking. Use your phone. Have someone record you from the side as you walk naturally. Watch the video. Are you heel striking? Are your knees locked straight when your foot hits the ground? Now practice this. Take shorter steps. Land softer. Keep your knees slightly bent throughout your stride. Think about your foot rolling from heel to toe rather than striking the ground. This will feel awkward at first. Your calves might get sore. That's normal. You're using muscles that have been dormant but persist. Within 2 to 3 weeks, this new pattern becomes automatic. Your knees will thank you with every step. Strategy Factor 5: lose the extra weight. I have to address this because it's the elephant in the room. I'm going to be direct because I care about your knees more than your feelings. Body weight matters a lot. Here's the physics. For every pound of body weight you carry, your knees experience 4 pounds of pressure during normal walking. 4 pounds. That ratio increases to 6 pounds during stair climbing. So, if you're 20 pounds overweight, your knees experience an extra 80 pounds of pressure with every step. If you're 50 pounds overweight, that's 200 extra pounds per step, thousands of times per day. Your knee cartilage is approximately 1/4 inch thick. It's designed to handle normal body weight. But when you exceed that normal range, the cartilage compresses beyond its capacity. Microfractures develop. Inflammation sets in. Arthritis accelerates. I've had patients lose 20 pounds and experience complete resolution of their knee pain. No other interventions, just weight loss. I know this is uncomfortable to hear. I know there are metabolic factors, hormonal issues, stress eating, and medications that cause weight gain. I understand all of that. But the biomechanical reality doesn't care about the reasons. Your knees are bearing a load they weren't designed for. Your action step: I'm not giving you a diet plan. There are thousands and most don't work long term. Instead, I'm telling you what works from a medical perspective. Create a caloric deficit of 500 calories per day. That's it. You can do this by eating less, moving more, or both. 500 calories per day equals 1 pound lost per week. In 6 months, you'll lose 24 pounds. Your knees will experience 96 fewer pounds of pressure with every step. How do you create a 500-calorie deficit? Skip the evening snack. Replace soda with water. Walk for 45 minutes. The specific method doesn't matter, the consistency does. Track your weight weekly. If it's not decreasing, adjust. If it is, maintain your approach. Your knees will improve proportionally to your weight loss. This is the most predictable intervention I know. The transformation. Now let me tell you what happens when you implement all 5 strategies simultaneously. Week 1. Your inflammation begins decreasing as you eliminate seed oils. You feel less morning stiffness. Week 2. Your hip mobility starts improving. Movements feel easier. Sharp catching sensations reduce. Week 3. Your VMO begins firing properly. Your kneecap tracks better. Anterior knee pain decreases. Week 4. Your new walking pattern becomes more natural. Each step feels lighter. The cumulative daily stress on your knees drops dramatically. Week 6. If you've lost even 5 pounds, you're experiencing 20 pounds less pressure per step. Your knees feel younger. Week 8. All 5 strategies are working synergistically. Your inflammation is controlled, your biomechanics are optimized, your load is reduced, your pain is minimal or gone. This is what I've seen happen hundreds of times. Not with surgery, not with injections, not with expensive treatments, with education, with consistency, with addressing root causes instead of symptoms. Final thoughts. I want you to imagine something with me. It's 5 years from now. You never implemented these strategies. You continued eating inflammatory foods. You never addressed your hip mobility. You ignored your VMO. You kept walking with that destructive pattern. You didn't lose weight. Where are your knees now? How much has the pain progressed? How many activities have you given up? Are you looking at surgery now? Maybe you've already had it. Maybe it didn't work as well as you hoped. Now imagine the alternative. You started today. You made these 5 changes. You stayed consistent. It's 5 years later, and your knees feel better now than they did 5 years ago. You're active, you're confident, you're not afraid of stairs, hikes, or playing with your kids. Which future do you want? The choice is entirely yours. I've given you the exact protocol that has worked for thousands of my patients. It's evidence-based, it's proven, it's effective, but none of that matters if you don't implement it. So here's what I want you to do right now, before this video ends, before you get distracted and forget. Choose one strategy. Just one. Start today. Maybe you go through your pantry and eliminate seed oils. Maybe you do the 90-90 hip stretch right now. Maybe you order a resistance band for VMO training. Maybe you film your walking pattern. Maybe you commit to a 500-calorie deficit. Starting with your next meal, pick one, start there. Add the others as you build momentum. Your knees can heal. I've seen it too many times to doubt it. But they need you to give them the conditions for healing. And those conditions start right now. If this video helped you, share it with someone who needs it. There are millions of people suffering with knee pain who think surgery is their only option. Show them there's another way. And if you want more strategies like this, evidence-based medicine that actually addresses root causes, subscribe to this channel. I post new videos every week. Your knees carried you this far. Now it's your turn to take care of them.